Is it true that after a hip replacement, someone should not bend at the waist and touch their toes? Is that a dislocation risk?
The question is it true that after hip replacement, a patient should not bend over at the waist or touch their toes? When you have a hip replaced, it is a known risk of the procedure that the hip could dislocate or come out of socket. Fortunately, it's a very, very low risk, but it is a known risk. As far as bending over at the waist, it depends a little bit on how the procedure was done. Surgeries that are done through a posterior approach or from the back have a higher risk of dislocating from the back, and surgeries that are done from an anterior approach or from the front probably have a higher risk of dislocating from the front. That position, bending over at the waist, would place you at risk for the hip dislocating posteriorly or from the back. Different surgeons, based on techniques, patient variables, and factors, have different feelings about precautions that a patient should take after surgery. So if anybody has that question specifically, something to bring up with your doctor or your surgeon. But the most critical thing is to know that while you're healing from surgery, which generally takes about 3 months, the risk of a dislocation is going to be highest because your soft tissues aren't healed. Once they heal, the risk goes down quite a bit.